I have a bunion. This is a complaint that we hear probably a dozen or so times every week from our patients. When someone comes in and says that they have a bunion, there's a couple different conditions they might be referring to, but they're just generically calling it a bunion. The most common bunion that we see at our office is something called Hallux abductovalgus. It's the truest form of a bunion. And in this condition, what is actually going on is there's pain in the big toe joint due to some pressure and because of a slight dislocation that happens over a prolonged period of time in the big toe joint. This condition is called Hallux abductovalgus because it describes the actual deformity that's happening within the foot. Hallux means big toe, and valgus talks about the rotation of the toe, whereby the toe leans over towards the smaller toes and rotates in a way that makes the toenail less than level with ground. When people have Hallux abductovalgus, or the true bunion deformity, their pain is usually to the inside aspect of the big toe joint. This area oftentimes also demonstrates a form of a prominence. A lot of people think that that prominence is extra bone, but it's actually this particular bone called your first metatarsal when it becomes out of position and we're seeing bone that we otherwise normally wouldn't see. Another thing that people describe as a bunion when they come in can refer to pain that they have more on the top of the big toe joint or within the toe joint itself. And this condition is something that we refer to as hallux limitus. Hallux again meaning toe, and limitus meaning there's limited motion within that big toe joint. This is different in that, again, the bump is on the top of the joint rather than on the inside, and it's corresponding more with an arthritic condition that forms either as the result of trauma or poor mechanics in the foot over a long period of time. No matter which of these conditions is happening, we usually start with conservative therapies, and over time, if that doesn't resolve your symptoms through padding, strapping, anti-inflammatories, and orthotics, surgery and injections can also be discussed. If you think you have a bunion, come on in and we'll take a look at it. Bunions, when we evaluate them clinically, gives us some of the information, but x-rays also give us a lot of helpful information to make sure that we can come up with a treatment plan that works for you.